Now, King County continues to see record drug overdose deaths at an alarming rate. In fact, Washington state has one of the highest overdose rates per capita anywhere in the entire nation, despite all the money that we are spending. The most deaths in a single week since we started putting up our weekly tracker occurred last week between August 10th and August 14th. So, over a 5-day period, there were 19 in just King County, 19 drug related deaths. And data provided to us from the medical examiner says one of the victims was a 15-year-old girl, a 15-year-old girl who lost her life to a drug overdose in our part of the state in King County last week. Most overdose since we started tracking back in May. We are putting this up as a weekly tracker. And this time we have some comments from the Discovery Institute's Center on Wealth and Property. One of their project coordinators and a research fellow at Discovery Institute is Marcia Michaels, and she spoke with my editor, Andrew Paxton.
Washington State has very permissive drug laws by design. And most of us saw that shift in our adult lifetime. So now, where we don't punish, or we don't have laws against having hard drugs and possessing drugs. We often don't enforce laws against the selling and trading of drugs. And so we get a predictable result, which is that this substance that for many people is a huge snare. If you talk to people who are in recovery, talk to many addicts, they don't want to be addicted to drugs. But we are comfort loving creatures. We are pleasure loving creatures. We have a hard time self regulating. And so when you have good boundaries around your life, a loving family, a good social network, good laws, they're actually enforced. It really helps human beings live and thrive. Well, in Washington State, we have removed a lot of those barriers. For some, I think it's a false idea of compassion, that if we're just soft on people, they'll be able to choose to do right. For most of us, that's a really difficult thing to ask, that we just do right all the time with no nudging, no boundaries. And so Washington has made it a very fertile area for drugs, drug trade, so of course we have dealers selling and people using. So that's a huge problem. It's just permissive drug policies.
Now, keep in mind, just King County spent $50 million in 2025 for resources and services, including low barrier medications for opioid use disorder, distribution of naloxone, their outreach teams. That was their 2025 year budget just for King County, $50 million. And again, that's not for programs that are forcing people to get off drugs and save their lives, but in providing things like clean needles, clean foil, naloxone, that no barrier housing where you can just use in the privacy of your home. Now, according, as I mentioned, to the Centers for Disease Control, Washington State ranks in the top of drug deaths per capita. So, like we were talking about last week during episodes of Washington in Focus Daily, the Law Enforcement Assisted Diversion Program, the LEAD program, which was started right here in Seattle, King County, is now under incredible scrutiny after Washington Policy Center and Eric Zimmerman came out with their report basically refuting all of the success data points that LEAD has been citing. And on the federal level, has gone to Congress and said, "Hey, look at the numbers. The recidivism's down. People, some of them get jobs. This is working to great success." Well, that apparently is not the case, and so here we have the evidence of 15-year-old girl among the many deaths, 19 of them in King County just last week due to drug overdose. And my editor, Andrew Paxton, has put up a lengthy article on the Center Square Washington page today. I encourage you to check that out. And a quick tease for tomorrow. I'm not going to give you too much information, but Andrea Swart, this all relates. Andrea Swarhez of We Heart Seattle, the ones that are out there picking up the used needles and the foil and the human feces in our parks and our streets in Seattle. She's now under investigation from Labor and Industries. And get this, it's for alleged improper handling and disposal of the drug needles and the used foil and the human feces. Now, mind you, King County Public Health hands out these clean drug use kits to users. Here's a clean needle, here's some foil, here's some naloxone, here's a tourniquet. Literally, these are the things that King County Public Health with taxpayer money is putting out. Andrea goes out there with her team and cleans these things up, and now they're coming after her. A lot more on this because she's got a plan to kind of turn this back around on them. We'll share that in tomorrow's episode of Washington in Focus Daily. I'm excited to share that story. So thanks for watching on this Monday, August the 17th. I hope you enjoy the sunshine. It's another beautiful day out there. Hope to see you again on Tuesday.